Hi everybody, welcome to Healthline. I am Gregory Zarin. Summer is in full swing. So are you spending more time outside? Are you hiking? Are you swimming? Are you doing more sports? Are you turning off the TV, turning off your iPad, closing down the computer, getting off the games, and spending more time with your family and your friends? Here at Healthline, we invite you to be as healthy as possible. Are you drinking more water? Yes. Are you putting on your sunscreen between 15 and 30 SPF? Yes. And are you just being careful? You know, when you spend more time outside and in the sun, we don't think as much about taking care of ourselves. So just be a little more cautious. Know what you're doing, and more than anything, just have fun. It is June, but in May it was Stroke Prevention Awareness Month, where the conversation of stroke was on all of our minds. Joining us from Adventist Health is Mikayel Grigoryan, interventional neurologist, and we're going to spend time talking about stroke, what to look for, signs and symptoms, and aneurysms. Welcome, doctor. Welcome back.
Thank you very much. Thanks for having me.
I'm so glad you're here. Doctor, you know, when we think of stroke and aneurysms, we talk more about strokes than aneurysms. Off the top of your head, what is the one difference between those two that we need to know?
So that's a great question. Traditionally, stroke, what people mean by stroke is the blockage kind of stroke, when you have a cessation of blood supply to a certain vessel because of a blockage. Aneurysms, when they burst open, they cause the second kind of stroke called hemorrhagic stroke. When the pipe, if you think of a blood vessel as a pipe, bursts open and there is a bleeding in the brain. It's not as prevalent and not as common as the ischemic kind of stroke, which is traditionally meant or labeled as a stroke, but the consequences of it are much more drastic.
What I loved is when we were talking before we started, you talked about stroke as like plumbing.
Correct.
And sometimes when I've talked about stroke on the shows, we talked about, you know, when you suffer from a stroke, it's kind of like the freeway you're driving down gets stopped, and
Absolutely.
you have to take an alternate path to get to where you're going.
Mm-hmm.
What happens more, strokes or aneurysms?
Ischemic strokes are more often, but the hemorrhagic strokes, of which a ruptured aneurysm is part of, are less frequent but more deadly, more devastating in terms of consequences.
When you give me, before we head off into break, when you think of the word aneurysm, give me one word.
Headache.
Headache. Between now and when we come back, have a glass of water, do some stretching, and the differences between stroke and aneurysms. And also, do you know what be fast means? More when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarin. So I hope you had 2 glasses of water. I hope you did some stretching, and maybe you got some carrot sticks and you didn't have a cookie or something that was not grown in a garden. Our mission here at Healthline is to have you be as healthy as you can be. And you always hear me say that a lot, because you don't wake up and something happened. You wake up because you weren't eating as healthy as possible. You weren't working out as much. You wondered how you put on all that weight. Things just don't happen. We are the reasons things happen. So drink more water, have more fruits and vegetables, and get out, run, and have more activity with your family, friends, because as I say here all the time, we are the captain of our own ship. The conversation is all about stroke and aneurysms. And joining us from Adventist Health is Dr. Mikayel Grigoryan. Doctor, before we went off to break, I said the word be fast. And that is an acronym in regards to what you need to look for in case you are suffering from a stroke, or somebody is suffering from a stroke. Can you please break down what that is?
Happily. So the key in a successful stroke treatment is the timely identification of the stroke.
Because the saying is time loss is brain loss.
Absolutely, because stroke treatments are very, very time sensitive. So the easier way to educate the general public is to use certain acronyms which contain in themselves the key symptoms of stroke. The word behind the BFAST is sudden. B stands for balance, so it's sudden loss of balance. When I was walking fine and now I'm walking like on a rocking boat, or like drunk, or there's an earthquake under my feet.
And it just happens?
Exactly.
Okay.
Eyes, sudden loss of vision to one side or to the other side. It could be one eye, but usually both eyes.
So complete sudden loss?
Of the vision,
Yes.
sudden. Sudden
Okay.
is always the keyword behind every single letter in this acronym.
I love that.
F is the face, sudden face droopiness, which is probably the most common symptom with which patients present to the emergency department because family and loved ones always notice when the face becomes droopy. Arm, sudden.
Real quickly in regards to the face drooping, because I know the face drooping is also associated to Bell's palsy.
Correct. The difference between the stroke weakness of the face and the Bell's palsy weakness of the face is A, stroke weakness of the face is sudden, and B,
Love that.
the stroke weakness of the face usually doesn't affect the eye, it only affects the lower face.
Okay, and when you were talking balance, eyes, and like the drooping of the face, does all of that happen, or are we looking for just one or two?
It could be one, it could be several, it could be all. Even one is enough to suspect a stroke.
Okay.
Again, the key word is sudden.
Sudden.
A stands for arm, sudden drop in the arm. I was holding something in my hand and then boom, my arm dropped. And it's unilateral. The one side, it's usually one side
Okay.
that gets.
Does it matter which side, or it
No.
can happen? Okay.
No. That just gives doctor a clue where the stroke is
Okay.
happening. S stands for speech, sudden inability to speak or sudden trouble understanding speech. And T stands for time. Summarizing all of the above, time is the key, time is of the essence, call 911 right away. So the T concludes the whole acronym, call 911, time is brain.
And again, be fast. Balance, eyes, facial drooping, arms, speech,
Time.
time. And in regards to Adventist Glendale, where it's a certified stroke center.
So not every hospital is equally equipped to treat the strokes because when you call 911, paramedics know very well in the city of Los Angeles where they are going to take you. Adventist Health Glendale is what's called a comprehensive stroke center, which similar to that would be
Accredited.
a level 1 trauma center, which is the hospital that can take on any kind of stroke anytime. We never ever refuse an admission for a stroke. We never ever refuse transfer request for a stroke. We are available truly 365 24/7. There is neurosurgical service, there is a neuro-intensive care service, there is a phenomenal emergency department which allows to triage the strokes properly. We
just
can
gonna say
handle
triage.
any kind of type of stroke. Ischemic stroke, hemorrhagic stroke, light stroke, big stroke, doesn't really matter. There are few comprehensive stroke centers in Los Angeles, and when you call 911, if paramedics determine that you're having a severe kind of stroke, then they may not take you to the closest hospital, but they will take you to a comprehensive stroke center because that's the better place for you to be.
And one thing that people need to know is do your research, find out where you live, find out where the certified stroke center is, find out where a heart institute is, find out the best place to go in case you have to call 911. And one thing too we talk about here is in your wallet, in your purse, and tell your family members and loved ones what medicine you're taking. Because you may need to see somebody that is suffering from a stroke and you need to know exactly what's in their body.
Absolutely. The more information the paramedics can gauge from the family or friends of the person who is suffering the stroke, the faster and the more timely the help will occur.
In regards to strokes, signs and symptoms, same for men and women, yes?
Yes.
Because I did some research earlier, it said more than 140,000 people die each year from stroke just in the United States, and approximately short of 800,000 people suffer from a stroke every year.
Correct. That's the statistics we have.
Why so high?
Stroke is #1 cause of disability in the United States. And used to be the second leading cause of death, but due to the modern treatment, that dropped down to #5. But the frequency of it occurs because there are many, many risk factors for stroke. And they're slightly different for ischemic stroke or for hemorrhagic stroke, but nonetheless, the most prevalent diseases in the society, high blood pressure, diabetes, tobacco abuse, cholesterol, they're all typical risk factors for stroke.
And same thing for men and women.
Yes.
In regards to high blood pressure, people are born with high blood pressure, yes? Hereditary.
Some are, and some develop it over the course of their lifetime. Definitely dietary habits and other things can contribute to the development of the high blood pressure, but they can be hereditary as well.
Give us some healthy solutions to lowering our blood pressure, doctor.
Dietary-wise, it's eat the diet that's limited in salt.
Salt.
Weight loss.
When you say salt, we're talking like everything white. Salt, flour, carbs,
Absolutely.
all of that.
The reason I mentioned salt is because people frequently don't look at the package and see how much salt contains. A pack of chips, for example, Lay's or whatever, I don't want to talk particular brands, but they contain tons of salt. And people never pay attention to that because those things are tasty. People don't read.
Well, no, what's interesting is a lot of people think, well, I'm on a vegan diet. Mm-hmm. And when somebody's on a gluten-free vegan diet, they need to turn the package over, because then if you turn it over, what they're not getting in what we get for not eating a vegan chip, a lot of that is tripled by salts and other things that we don't know what that is.
Correct, to make it tasty. But that comes at the price of sodium content, which in turn contributes to raising your blood pressure, among other things.
So bottom line, just eat more fruits and vegetables and be healthier.
Yeah.
More with Dr. Grigoryan when we come back. And so I have a question. How much salt do you use? How much activity do you or don't you get? We've said this a lot here on Healthline, so let me see if you've paid attention. What is the minimum amount of exercise you are supposed to get every week? How many minutes? Let's see if you're paying attention. More when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarin. So the question was, how many minutes minimal a week are you supposed to work out? The answer is 150. As I said earlier, you just don't wake up and boom, you are so overweight. What happens is you come home from a long day, you put food in your mouth, you feed your kids, you don't get exercise. One day turns into a week, turns into a month, turns into a couple of years, turns into a couple sizes. Instead of coming home and watching TV and not interacting, get up, get out as a family. The more you teach your kids about being active, which was taught to me, the more you as a family are going to learn how to have a healthier lifestyle. Joining us from Adventist Health Glendale is Dr. Mikayel Grigoryan, and the conversation is about stroke awareness and aneurysms. Backtracking just a little bit, doctor, you said high blood pressure. Anything else you want to share about that in regards to what we need to be aware of in regards to high blood pressure?
So high blood pressure is known to be probably, if you put rank all the risk factors for stroke, high blood pressure, based on every epidemiological study everywhere in the world, is deemed to be #1 risk factor for stroke. There is a reason why they call hypertension a silent killer. This is particularly true for the bleeding kind of stroke, for hemorrhagic kind of stroke, because high blood pressure is one of the 2 main risk factors for the formation of aneurysms. Aneurysms are bubble-like outpouchings on the vessels that can occur anywhere in the body. The aneurysms in the brain are the most dangerous. They're very dangerous because they don't cause any symptoms in and of themselves. You cannot, unruptured aneurysm does not cause any symptoms. There could be 100 people walking on the street. We can stop them, scan their brain, and chances are that in 3 or 4 out of them, of 100, that's the incidence of aneurysms, we will find an intracranial aneurysm, an aneurysm inside the brain. They only manifest themselves when they rupture usually. And when they rupture, they cause a bleeding in the brain. And the 2 key risk factors for that are high blood pressure and cigarette smoking. Those are the 2 proven risk factors, because you're not born with an aneurysm. Aneurysm forms along the course of your life due to those risk factors.
Let's talk about cigarette smoking. It's deadly.
Yes, out of all the habits, and I don't know, why some people are so attached to cigarette smoking. I can't think of, for example, there are a lot of articles about, minimal alcohol use being, beneficial in this and that. There is not a single article, not a single trial, not a single fact that would prove that any amount of cigarette smoking is beneficial in any regard. And yet it's so ubiquitous and so prevalent, and it has so many, it's virtually responsible for the vast majority of cancers, and it certainly has its role in formation of the aneurysms.
Many lifetimes ago, it was glamorized. hi, if you smoke so-and-so, it's going to be healthy for you and it tastes great. And I smoked 2 packs a day for 20 years, and I quit 14 years ago.
Good for
and
you.
It's the best thing. So here's the thing. Every time you light up, you're killing yourself, period.
Absolutely.
So so for those of you that smoke, every time you light up, you could be causing an aneurysm, which could then kill you, and then it wouldn't be a great thing. So just put it down. Every time you pick something up, it's a choice. Every time you put something down, it's a choice. So make a healthy choice. In regards to, so I can wrap out strokes a little bit, just say someone suffers from a stroke. There are a few, you can do TPN. You can do, what are other solutions to stroke?
So for the blockage kind of stroke, you can do, there's 2 things. There is an intravenous treatment, which is a drug given by vein. It only works within the first 4.5 hours. They're very strict and rigorous
Back to
time
time loss
criteria.
is brain loss.
Yes.
Okay.
The second, also time-sensitive, but not so time-sensitive treatment is the thrombectomy or brain plumbing.
Okay.
That's when I go through a blood vessel in the leg or in the arm, go up to the brain and try to pull the big clot, big blockage out, which is why it's so similar to plumbing. When you have a clogged pipe, you call a plumber, he uses roto-rooter or some, whatever it's called, the device that gets the clot out. We use a variety of our devices to get the clot out. That works usually within the first 24 hours. It's not going to work in everybody. We do sophisticated imaging to determine, because stroke is like forest fire, blockage kind of stroke. Depending on what moment firefighter arrives, the stroke may have burned through the forest, and then whether you extinguish the fire or not doesn't matter, because it burned the whole forest. If you are quick enough, and that quickness is different because every human is wired differently, depending on that, you will have success more or less. So we do some fancy CAT scans, which will determine who is going to benefit more or not, but that option is available to a lot of patients with strokes to get the blood clot out.
And more men or women, or it could be both?
Strokes are more prevalent in men, but women are, at the end, more disabled from stroke.
And just say someone suffers from a stroke, they go through the medical procedures. How important is physical therapy?
That's a key. Because what I do has effect initially, and usually a lot of people will still have some sort of residual deficit, because stroke does not wait until you do the procedure. So the key is physical therapy, occupational therapy, and speech therapy. Those people are heroes, and they are the ones who help the patient recover in the weeks, months following the stroke.
And bottom line, they get their life back.
Yes.
More on aneurysms when we come back. Don't go away. Welcome back to Healthline. As you know, my conversation is all about you and your family getting up and getting out. So I'm inviting you to a party, and you don't want to miss it. Bring your friends, bring your family, bring kids, pets, anybody and everybody to Glendale Central Park, August 24th from 10 a.m. to 1 p.m. for Glendale's first Wellbeing Block Party. And it is hosted by Adventist Health and the American Heart Association and American Stroke Association. Discover fun was meant in the form of exercise. Learn how to make healthy choices. Learn how to make healthy recipes. Bring home fruits and vegetables from the free produce market. It's just all about going out and getting involved and learning what you need to do to have a healthy lifestyle with your family. There'll also be Adventist Health doctors, and they'll be there to answer your questions. And there's also a kids zone for the little ones who will be entertained. Again, the event is free and it is open to the public. Saturday, August 24th from 10 to 1, Glendale Central Park. We will see you there. And to learn more, please visit AdventistHealthGlendale.org. So, Doctor, thank you again for being here and sharing with us what we need to know, Dr. Grigoryan. People don't talk about aneurysms.
No, they
we
don't.
hear about it, but we don't discuss it. Why is that?
Because aneurysms are not manifesting themselves until they rupture. And I think it's very important to talk about aneurysms because the bleeding that they cause is called subarachnoid hemorrhage. It's a particular kind of bleeding in the brain. Just to give you statistics, 40% of patients die before they even make it to the hospital when an aneurysm ruptures.
Because it's so quick?
Because it's so devastating. It's like somebody took a bucket of water and spilled it all over the room. The bleeding is over the linings of the brain, the coverings of the brain, and it's everywhere. And the consequences could be devastating. That's why it's such a deadly disease. Another 1/3 of the patients remains profoundly disabled or dies in the hospital despite us extinguishing the source of the leak. And only 1/3 of the patients goes back to normal life or close to normal life. That's why it's so important to, when you discover that you have an aneurysm, because aneurysms mostly don't cause any symptoms unless they're very, very large and they compress the structures around them. You will never know that you have an aneurysm. But if you know that you do have an unruptured aneurysm, it's very important to see a doctor to determine what's more risky and what's more beneficial, to treat an aneurysm and to withstand the risk of surgery, or to leave it alone. What is your rupture risk? And when we try to calculate the rupture risk of any given aneurysm, we take into account a lot of things. High blood pressure, cigarette smoking, race, believe it or not, because funny fact, the highest incidence of aneurysms in the world is in Finland.
Really?
And the second highest is in Japan.
Okay.
We don't know why. Women suffer more subarachnoid hemorrhage than men. We don't know why. We think that because aneurysms are usually discovered in the age of 50 to 60, although a person of any age can have an aneurysm. Maybe it has something to do with a perimenopausal period or menopause and the differences of the shear wall stress, meaning the wall of the blood vessel becomes more weak around that time and the blood hits against it harder. Because basically what aneurysm is a bulge in the vessel wall that happens because of two proven facts: high blood pressure and cigarette smoking. And if it ruptures, and it can be small and rupture, and it can be large and rupture, it causes very devastating consequences.
And there are no signs?
The sign of a ruptured aneurysm is a headache. The sign of unruptured aneurysm are virtually none.
Is it a reoccurring headache? Is it a headache like, oh, I have a headache?
No, the aneurysmal headache of a ruptured aneurysm is very specific and it's very particular. It's like, you go from lights on to lights off. It's going from 0 to I have the worst headache of my life. So the typical presentation of a patient in the emergency department is either I have the worst headache of your life, or the family says, oh, he complained of the worst headache of his life and then he passed out.
Okay, and it's sudden, is it sudden?
Sudden, absolutely, very sudden.
Because a lot of the times that we have headaches, we're dehydrated.
Yes.
What is the recovery rate in regards to somebody that has an aneurysm, treated?
So unlike the blockage kind of stroke, the ischemic kind of stroke, when you extinguish the source, you basically open the pipe or open the path. From there on, physical and occupational therapy can take over, and it's all the path towards recovery. When we treat the aneurysms, and we treat aneurysms by, used to treat by open surgery when you crack the skull open and put a surgical clip on the aneurysm. Nowadays we treat aneurysms with minimally invasive techniques. Same way we go through the groin, only instead of pulling a clot, because there is no clot, we actually patch up that leaky area with a bunch of either platinum wires, they are called coils, or we put a particular kind of stent, a wire mesh that sort of redirects the flow and makes the blood flow through a normal vessel and shuts down the flow to that bulgy area, the aneurysm. After that, you have to deal with all the blood that got spilled out. So that there is a very long and protracted course of recovery, which takes up to 2 to 3 weeks. Patients usually spend 2 to 3 weeks in the hospital after a ruptured aneurysm is treated. So that's why it's a much more debilitating and devastating disease. And it also takes physical and occupational speech therapy, but there are a lot of medical complications that can arise later, and it requires very sophisticated, comprehensive care, including critical care. That's why it's very important that such patients are treated in comprehensive stroke centers.
Can somebody fully recover from an aneurysm?
Yes.
Does it occur more men or women?
Actually occurs more in women. Emilia Clarke, the actress on Game of Thrones who played Daenerys Targaryen, had reportedly, I haven't seen her images, but she reportedly had a subarachnoid hemorrhage, and she recovered from it fully, as you can see by her acting talent.
And speaking of, yes, Game of Thrones fans, and speaking of celebrities that have suffered, the actor Luke Perry suffered a massive stroke and died at 52, and then acclaimed director John Singleton. Before we wrap out, ethnically and culturally, why do strokes, I just read African American men, their health is a lot more, they're not as healthy?
So one of the reasons is hypertension. There are racial prevalences in the rates of certain diseases, and hypertension is quite prevalent in the African American. The other reason is atherosclerosis or hardening of the arteries affects different parts of the body differently. And in African Americans, Hispanics, and Southeast Asians, there is a lot of hardening of the arteries, atherosclerosis in the vessels inside the skull, which contributes to the rates of stroke.
Final thoughts in regards to strokes and aneurysm prevention, doctor?
Be healthy, know when to call for help, know the signs of symptoms of stroke. There are various ways you can prevent both of them. There are various ways you can treat both of them. Know all about it and know how to act to get the help.
And when you say be healthy, what does that mean?
Eat healthy, exercise, enjoy life, stay positive.
And quit smoking.
Absolutely.
It's always a pleasure to have you here.
Likewise.
Will you come back again?
Absolutely.
Because since we both cut off our hair, we look great. Okay, so you heard from Dr. Grigoryan. Bottom line is be healthy. And what does that mean to you? For me, that means getting up and getting out and having fun with your family and friends, working out, raising your heart. You know, for all of you that work in an office, get up, walk around your campus, the building, drink more water, put down the soda, ask your family questions. What's your family history? Hereditary is extremely important. Have the conversation about health with your family. The more you give to them, the more you're going to get back, because you could have said to someone that you watched the show and said, hey, did you know the acronym to stroke is Be Fast? And you can break it down to someone you love. Conversation is going to save your life. So the most important conversation you will have is about you and your health. So why not pay it forward and give it to your family and your friends? Our mission here is to have you be as healthy as possible. You can find us on all types of social media. Facebook at AH Glendale, Twitter at Adventist Health, LinkedIn at Adventist Health, and you can always visit the website adventisthealthglendale.org. And I'm on at Gregory Zarin. Thank you. Take care of each other. We'll see you next time.